Do you know the early warning signs of colon cancer? This isn't a casual question. Colon cancer is one of the most common yet overlooked health concerns today. Every year, thousands of lives are affected by this silent predator. Early detection can make all the difference, turning a potentially fatal diagnosis into a manageable condition. Understanding the early warning signs is crucial in this fight. So are you ready to be proactive about your health? Stay tuned to learn about the 10 early warning signs of colon cancer. If you find this video helpful, don't forget to subscribe to our channel for more health tips and insights. First up on our list is unusual bowel movements. When we talk about unusual bowel movements, we're referring to any changes from your normal routine, such as constipation, diarrhea, or changes in the consistency of your stool. This could mean you're experiencing thinner than normal stools, or perhaps they're harder and more difficult to pass. These changes can be a sign of colon cancer. It's important to remember that everyone's bowel habits can vary. What's normal for one person might not be normal for another. However, if you notice a sustained change over a period of time, it's something that should not be ignored. Keep in mind that occasional bouts of constipation or diarrhea are common and usually nothing to worry about. But if these conditions persist, or if there's a noticeable change in your bowel habits, it's crucial to get it checked out. Do not neglect any changes in your bowel habits. The second sign to watch out for is blood in your stool. Now, this may sound alarming, and it should be. Blood in the stool isn't something to brush off. It could be an early warning sign of colon cancer. So, how might it appear? Well, it can be quite subtle. You might notice streaks of bright red blood on your toilet paper or in the toilet bowl after a bowel movement. Alternatively, your stool may look darker than usual, almost black, indicating older blood. But here's the tricky part. Sometimes the blood isn't visible to the naked eye, as it's mixed in with the stool. This is called occult blood, and it can only be detected with special tests. So if you have other symptoms, don't assume you're in the clear just because you can't see any blood. Remember, seeing blood should always prompt a call to your doctor. Thirdly, persistent abdominal pain should not be ignored. Now, this isn't your average stomachache that comes and goes. We're talking about a consistent nagging pain or cramping that seems to stick around longer than usual. When it comes to colon cancer, this kind of discomfort can be a significant warning sign. Why, you might ask? Well, as the cancer grows, it can cause blockages in the colon. These blockages can lead to pain as the body struggles to move waste through the digestive tract. The pain can range from a dull ache to a sharp stabbing sensation and can be intermittent or constant. But remember, abdominal pain can be a symptom of many different conditions, some of which are not serious at all. It's crucial not to jump to conclusions, but instead, seek advice from a healthcare professional if you're experiencing persistent pain. They can help determine the root cause and plan the best course of action. Remember, persistent pain is not normal. Sign number 4 is unexplained fatigue or weakness. This symptom might sound quite common, almost like a side effect of a busy lifestyle. But when we're talking about colon cancer, it's a different story altogether. Colon cancer can cause fatigue and weakness due to the body's increased demand to fight the disease. This leaves you feeling constantly drained and tired, even after a good night's sleep. It's not just a case of feeling a bit sleepy after lunch or needing an extra cup of coffee in the morning. This fatigue is persistent and debilitating, affecting your daily activities. Weakness, on the other hand, often comes from the body's inability to absorb essential nutrients due to the cancer. You might find it difficult to complete tasks that you used to do easily. So if you're feeling unusually tired or weak, don't just brush it aside as a sign of getting older or stress. It's crucial to take these symptoms seriously. Always listen to your body when it tells you something is off. A fifth on our list is unexplained weight loss. Now, we're not talking about the few pounds you might lose from a new exercise routine or diet change. We're discussing significant sudden weight loss that occurs without any clear reason. This kind of drastic weight drop can be alarming, and rightly so. It might be your body's way of signaling that something is off. In the context of colon cancer, unexplained weight loss can occur because the cancer cells use up your body's energy supplies. Moreover, tumors can cause a blockage in the colon, affecting your body's ability to absorb nutrients. This, in turn, can lead to weight loss. Even though unexplained weight loss can be a symptom of many different conditions, it's crucial not to ignore it. If you're losing weight without trying, it's essential to reach out to a healthcare professional. Remember, knowledge is power. Weight loss without a known cause should always be investigated. Our sixth warning sign is changes in appetite. A diminished desire to eat or feeling unexpectedly full after eating only a small amount can be a subtle indication of colon cancer. Now, we're not talking about those days when you're just not in the mood for a big meal. We're referring to a persistent decrease in your appetite, a change that sticks around for more than a few days. This change can occur because a tumor in the colon may affect the normal functioning of your digestive system, leading to a lack of interest in food or a sensation of fullness more quickly during meals. It's important to remember that many things can affect your appetite, from stress and other illnesses to certain medications. But if you're noticing a significant and unexplained shift in your eating habits, it's time to talk to your doctor. They can help identify if this change is a cause for concern. Pay attention to any significant changes in your eating habits. Seventh is iron deficiency anemia. Now, this isn't your run-of-the-mill fatigue. Iron deficiency anemia is a decrease in the number of red blood cells caused by too little iron. This can make you feel tired, weak, and short of breath. Not exactly how you want to feel when you're trying to live your best life. But how does this relate to colon cancer, you ask? Well, colon cancer may cause bleeding in the colon, which can lead to iron loss. Over time, this loss of iron can result in iron deficiency anemia. So, if you're feeling consistently tired, weak, or short of breath, it might not just be because you're not getting enough sleep or you're overdoing it at the gym. It could be a sign of something more serious like iron deficiency anemia and potentially colon cancer. If you've been diagnosed with iron deficiency anemia, make sure to discuss colon cancer screening with your doctor. Eighth on our list is a feeling that the bowel does not empty completely. This sensation, often referred to as tenesmus, can be an early warning sign of colon cancer. It's an uncomfortable feeling, like you need to go, but when you try, there's little to no result. Now, why does this happen? Well, when a tumor grows in the colon, it can obstruct the natural passage of waste. This obstruction may lead to the sensation of incomplete evacuation, even after you've just been to the restroom. This symptom can also be accompanied by other changes in bowel habits, such as constipation, diarrhea, or changes in the consistency of your stool. It's important to note that these symptoms can be caused by conditions other than cancer, such as irritable bowel syndrome or hemorrhoids. However, if you consistently feel like your bowel doesn't empty completely, especially if it's paired with other symptoms we've discussed, it's time to consult your doctor. Any changes in your bowel movements should be taken seriously. Ninth on our list is bright red or very dark stool. Now, we may not typically give much thought to the color of our stool, but it can be a telltale sign of what's happening in our bodies. When stool turns bright red or very dark, it can be an indication of bleeding in the lower or upper gastrointestinal tract, respectively. This could possibly be a symptom of colon cancer. The bright red color might suggest that the bleeding is occurring closer to the rectum or the end of the colon, while the very dark or black, tarry stool, medically known as melena, could suggest bleeding higher up in the digestive tract, such as the stomach or small intestine. It's important to note that other conditions can also cause these color changes, like hemorrhoids, anal fissures, or certain medications and foods. But if you notice a persistent change in your stool color, it's always a good idea to consult your healthcare provider. Always be mindful of any changes in the color of your stool. Last but not least, nausea or vomiting can be a sign of colon cancer. Imagine your body as a well-oiled machine. When all parts function in harmony, you feel healthy. But when something goes awry, like an unwelcome guest such as colon cancer, it disrupts this harmony. The body reacts, sometimes by triggering nausea or vomiting. This happens because a tumor in the colon can obstruct the passage of food and waste, causing pressure buildup and discomfort. When the body can't move substances through the digestive tract as it normally would, it may respond by trying to expel them upward, leading to feelings of nausea or even bouts of vomiting. Persistent nausea or vomiting, especially if accompanied by other concerning symptoms, should always be taken seriously. It's your body's way of sounding an alarm, signaling that something's not quite right within. So, if you've been experiencing these symptoms consistently, it's crucial to seek medical advice. Never dismiss persistent nausea or vomiting. So, there you have it, the 10 early warning signs of colon cancer. We've journeyed together through the maze of symptoms that might be easy to dismiss or explain away, but that could potentially signal a serious health issue. We started with unusual bowel movements, a sign that can often be brushed off as a temporary upset, but may be indicative of something more. Then, we discussed the alarming sight of blood in the stool, a sign that should never be ignored. Abdominal pain, too, is a symptom that demands attention, as it can be a clear indication that something is awry within our bodies. We also touched on fatigue and weakness, which can often be dismissed as the result of a busy lifestyle, but may in fact be a sign of colon cancer. Unexplained weight loss and changes in appetite, too, can be misinterpreted as the effects of stress or a new diet, but could be symptoms of a more serious condition. We delved into iron deficiency anemia, a condition that can leave us feeling tired and weak and can often be attributed to a poor diet, but may in fact be a sign of colon cancer. Feeling that the bowel does not empty completely is another symptom that can be easily overlooked, but that should not be dismissed. We discussed the appearance of bright red or very dark stool, a clear warning sign that something might be wrong. And finally, we talked about nausea or vomiting, symptoms that can be easily attributed to a stomach bug, but could potentially signal colon cancer. The importance of early detection cannot be overstated. Regular screenings can catch colon cancer in its earliest stages, when it's most treatable. If you've noticed any of these symptoms, don't dismiss them. Consult with a healthcare professional to get the answers you need. Remember, early detection can save lives. Don't ignore the signs. Take action today.